Hello everyone, once again welcome to my IT channel. Today I came with a candidate cue card. This card actually appeared for the recent exam. So the content is nasal polypectomy and the patient is scheduled for the procedure within 2 weeks and you are giving information about the procedure. So mostly in exam you can expect one procedure or any surgery or any diagnostic procedures or discharge, post-discharge care related to any surgical procedures. So in such scenarios, the card and the content will be very large and you could not manage the time. So you have to manage the time by increasing the speed of your talk, as well as you can concise the point. Please don't give much explanation in any point. Okay, so these are the points you can keep it in your mind. During 3 minutes preparation time, just underline each and every important points and see the task what you are exactly going to do. Sometimes it will be confirmation, sometimes it can be explanation, sometimes it's like explore, or sometimes even it's just like discussion or outline. So the task is important to find out the core component of the conversation. So during 3 minutes preparation time, you can underline each and every point and you can put question mark in the left side of your task wherever you want to ask question to the patient, like do you have any concern, or still you looks anxious, is there anything to be clarified? Such things you can make with question mark. Okay, so we will go to the task. The first thing is, you can see that this is a 35-year-old patient is going to have a nasal polypectomy in 2 weeks and you are going to give the information about the procedure. The first things you can see that confirm this is a hospital outpatient department, you don't know regarding this patient. So the first task is confirm patient's appointment, that is a scheduled nasal polypectomy, and find out if the patient has any concern. As it is a outpatient department, this is the first time you are seeing the patient, but in your system, you will have the patient content or the patient data. So you can start like this. Good morning, my name is Reshmi Rajan and I am one of the registered nurses working in this hospital outpatient department. How may I address you and how can I help you today? Either in that manner you can ask, or else simply you can ask, may I know your complete name and age for my documentation purpose? So they will give you the answer with any name. My name is James Matthew and I'm 35 years old. Then you can tell that, well, Mr. James, from my system, I can see that you are scheduled for nasal polypectomy in 2 weeks, isn't it? Or is it correct? Am I correct? Like that, you can ask. Find out if the patient has any concern. So you have to ask, do you have any concern about the procedure? Then the question will be, yes, increase the patient, unblock nose, allow nasal breathing, immediate improvement. So that is the benefit of the surgery. So of course the question may be, yes, I don't have any idea about the procedure. Could you please explain me in detail? So we can tell that I'm really happy to explain you regarding the procedure, in which the blocked nose will be unblocked and it will allow the nasal breathing. It will give immediate improvement of your breathing pattern. Explain nasal polypectomy. The other informations are, in addition, it is a short procedure around 30 minutes and depends upon the polyp size and location. We will use the endoscopic machine, so there is no cuts or incision. There will be only tiny instruments. We will use it to remove the polyps and other substances if it is present. So are you getting my point? Like that, in a simple way you can talk. By listening this, maybe you'll think that I just read the point. So sometimes it can be read but without any grammar mistake. Okay, so make sure that you are giving enough information to the patient, but no need for explanation because it is a little bit bigger card and you will not get enough time to complete the task. The next task is outline the pre-procedure requirements like general anesthetic, avoid food and drink 6 hours before the procedure, clear fluid 2 hours. So possibly we can ask, do you have any more concern? Or else you can tell by yourself, I would like to tell you something regarding the pre-procedure requirement. May I proceed with that? Then you can tell that your procedure will be under general anesthesia, so your doctor will advise you to avoid food and drink 6 hours before the procedure, but you can take clear fluid in this time. Please try to stop the clear fluid just before 2 hours. Are you okay with that? Like that you can ask. The next task is explain the post-procedure expectations like possible bleeding, pack, overnight stay, bleeds heavily means pack will be removed before the discharge, these things and all. And some discharge care also they have given. So here you can ask, do you have any more concern regarding the surgery or any other points? So the patient's question will be, after the surgery, so what are things I have to expect? So we can tell that possibly there will be bleeding after the surgery. So we will keep the bleeding packs on your nostrils. So no need to worry. Overnight stay is mandatory for you. And because we can expect some more bleeding, means you will be in need to get some medical advice. So you can stay here overnight, and just before the discharge, the pack will be removed. Moreover, I would like to tell you some points to avoid. Please try to avoid blowing your nose heavily, some heavy liftings, bending head below waist. And after getting discharged, if you have heavy bleeding, please try to get back to the hospital as early as possible. Is it okay for you, or are you clear with that? Like that we can ask. Then once if you asked, do you have any concern, the next point, again before next point, no need to ask it again, you can continue. For your further information, I would give you some more information. So the next task is post-operative medication like painkillers, paracetamol, salt water, rinse or nasal drops for healing, corticosteroid to prevent recurrence. So we can tell that, Mr. James, I would like to explain you some more things regarding your medication. After your discharge, doctor will prescribe you some painkillers for your pain relief such as paracetamol, and you will be advised to take salt water rinse or nasal drops for healing. Moreover, or in addition, you will have corticosteroid to prevent further recurrence. Is it clear for you? Or are you getting my point? Or do you have any more concern? Or do you want me to explain anything more? Or you still look anxious? Is there anything to be clarified? Such things you can ask now. The next task is provide measures to prevent recurrence like corticosteroid spray, use humidifier to moisten nasal passages, improve mucus flow. Some other steps also they have given. So maybe their question is how I can prevent a recurrence. I don't want to get any more pain. So you can tell that I can truly understand your concern, James. I will tell you some measures to prevent a recurrence. So as I informed you, you will have corticosteroid spray. Moreover, you can use the humidifier to moisten the nasal passages. It will improve the mucus flow as well. Some other steps are, please try to avoid nasal irritants like dust, debris, smoking, and some common allergens. It's known as nasal irritants. If you feel irritation with any of the factors, you can just try to avoid. Is it okay? Or how does that sound? Like that you can ask. Then the last one thing you can tell that, yes, before conclusion, I would like to tell you the post-discharge arrangements. This is outline post-discharge arrangements, okay? So you can tell that please try to arrange someone to accompany you because you will be in restriction to drive for next 24 hours. So you can ask, do you have anyone to accompany on that day? Then their answer will be, of course, my brother will come or my friend will accompany me. So you can tell that I'm happy to know that. Before conclusion, you can ask once again, do you have any more concern? So their answer will be no. So you can tell that, Mr. James, I hope I have clarified all your doubts. If you have any doubts or if you need any clarification, please do not hesitate to contact with us anytime. We are here to help you. This is our contact number. I wish you a safe surgery. So with this, we can wind up the conversation. So these many things we have to go in a fast track. You have to include the patient as well. So what you can do, as I told you, you can put a question mark in the left side of your task so that you will not miss to ask and you will not neglect the interlocutor to participate in the conversation. I hope this is beneficial for you. You can practice the same card with your friends, record it and listen by yourself, and you can get your own correction. Okay, we will see you with another informative video. Until then, bye. Take care.